Hello, darlings. Welcome to Tea with Justine. Remember my friend Janet Byrongian. She is a therapist who specializes in sex therapy and sex addiction therapy, and we were talking about a whole different kind of therapy that I had no idea existed, because we're so used to like talk therapy when we just talk to our therapist. But there is a form of therapy called EMDR, which stands for
eye movement desensitization and reprocessing.
Yes. Tell us about EMDR, because
Yeah.
it was so interesting to me, because I think so many of us don't realize that there are other forms of therapy that can help us, because sometimes talk therapy only goes so far,
Yeah.
and then we like run out of talk, or we just talk in circles.
Yeah.
So tell us about EMDR.
EMDR is a form of therapy that uses bilateral stimulation to target particularly traumatic memories.
Mhm.
So it's for clients that have PTSD,
Yeah.
post-traumatic stress disorder, although it's used for other types of clients with other symptoms. But basically, for example, like if you think of talk therapy, it's an amazing form of therapy to just talk things out and let things out.
Yeah.
But if you think of talk therapy, we're only focusing on one part of our brain, which is the prefrontal cortex, which is
Right.
where our thinking pretty much lies. But let's say if we're dealing with trauma or traumatic history or traumatic memory, so much of that is stored in the body. And with talk therapy, it's sort of hard to really target that.
Yeah.
So EMDR, it's a form of therapy where you work with clients and you engage with them through bilateral stimulation. And the way that I can describe bilateral stimulation is, so if you're familiar with REM sleep,
Yes.
right? So REM sleep is where our unconscious memories come up.
The
and
deepest part of our sleep, right?
deepest part of sleep, and that's where we have a lot of our dreams. A lot of our dreams don't really make sense. So that's where a lot of our unconscious memories come up through dreams. And so with REM sleep, our eyes are actually moving back and forth bilaterally. So EMDR mimics REM sleep in a way, because your eyes are moving back and forth. So how I can
Yeah.
pretty much demonstrate it, where I would ask my clients to just basically follow my finger back and forth, right, for several sets. And doing so brings up some stuff that was in our unconscious.
Okay.
That not necessarily we would know was there. Certain things like core beliefs or certain memories that we weren't aware was there. Things like that.
It's really powerful.
It's really powerful work.
Yeah.
It's deep work. Often I have clients that share with me, core beliefs of like I'm unlovable, or if it's like a sexual trauma, I'm damaged goods. And they were not even aware that that core belief was in there.
That's incredible to be able to bring that out.
Yeah.
The hand movements reminded me of hypnosis. So what would be the difference then?
So I'm not like trained in hypnotherapy, so
Yeah.
I'm not the correct person to ask, but there are certain aspects of hypnotherapy that's very, very similar to EMDR. Primarily, it's just using a different part of our brain, and it's bringing up a lot of some of the unconscious awareness with hypnotherapy. I mean, with EMDR, it was developed by a psychologist named Francine Shapiro, and Shapiro noticed that the story is that one day she was walking through a park and she was dealing with a lot of distress over something, and she just noticed her eyes just moving back and forth in different directions, and she noticed that by doing so for several sets that she actually felt a lot better. She felt a lot more clarity and more at peace. And so in terms of the science of it, pretty much it's basically you're mimicking REM sleep, and the bilateral stimulation brings up a lot of the unconscious stuff.
That's so interesting.
And it's not actually bilateral stimulation just with eyes. We have tools called pulsars where clients can hold pulsars in their hands, and it vibrates back and forth.
Oh wow.
So if clients don't like the eye movement, they can do a closed eye process where they feel the pulsars, and we ask them to identify the particular image that they want to work on, or the particular memory or experience, and that brings up with the pulsars a lot of different information too.
That's so interesting. And Is it common to find therapists who are trained in EMDR?
Very accessible. There's a lot of clinicians that are now trained and certified in EMDR interventions, and you can find them through the EMDRIA website, the EMDR International Association. So it's emdria.org. You can just type in your zip code and try to find somebody. You know, often on your like mental health insurance panel, you can call them and request a particular type of therapy. So EMDR can be one of them, and there's a lot of EMDR therapists that are on insurance panels as well. It's pretty accessible. We live in LA, so it's very accessible in LA. Maybe different parts of the country are a little bit different, but it's growing. It started out in the 80s, and it's just really grown.
Awesome. Yeah. So you mentioned, you know, this is really helpful for trauma patients. Is this something that could work for other types of patients, or is it particular for trauma patients?
Yeah, it's used for a lot. There's actually a lot of research that's coming out on different diagnoses or symptoms. So often this is also very well used for clients with like anxiety or panic disorder, stuff like that, clients with depression. And I know it's not necessarily as commonly used for addiction, but I've seen more growing research for clients with addiction issues. So it's really growing for all types of diagnoses and symptoms.
Well, I think that's so great that people can know that there is something else out there to help them if they feel like they're not getting what they need through talk therapy or through other resources.
Yeah, and I'm not saying that talk therapy doesn't work. I think talk therapy is great, and so many clients need that. But I think, you know, if you're noticing just you're not getting better, you know, because
if you're like hitting a wall,
if you're getting stuck, it might be time to try different things. And if it's not EMDR, you know, you can try other somatic interventions. I'm a firm believer that so much of our past history is so much stored in the body, so I really believe in doing the body work in therapy.
Do you consider it more like a supplement to talk therapy, or are there patients who start out with just EMDR?
There are people that just start out with EMDR, so I think it's both. So a lot of people just start with regular talk therapy. They find that they need more, they're just not really improving, so they'll seek out, or their talk therapist might recommend EMDR or something else.
Okay. Awesome. Yeah. Well, thank you, Janet, for coming to have tea with me again.
Of course.
I hope you all learned a little something, and know that if you are in need of help, you know, therapy is always great, whether that's talk therapy or EMDR now, or other forms of therapy that might be helpful to you. If you'd like to reach out to Janet, we'll post her information below in the description, but you can find her on Instagram at Therapy with Janet B.
Yes.
And you can also look her up at Meridian Clinical Group. All right, thank you all. See you all next time. Bye.